So I initially started volunteering at the Children's Hospital where my mom worked. It was called Le Bonheur Children's Hospital. She'd been there for many years in various departments. And I volunteered with her and loved watching her, the nurses, the doctors, interacting with patients and children. I loved seeing how they took care of them. It really energized me. I feel like taking care of children in that way provides me with a deep sense of purpose. I really love that medicine is a field where providers, nurses, physical therapists, doctors, anybody, are all working for years and years on their education, all with the primary goal of taking care of patients. That's huge to me. I was really drawn to ophthalmology in the beginning because I was interested in the microsurgical field. But more important than that, the eye is a very complex part of the human body. There's multiple segments of the eye, and each segment has its own subspecialty. I loved how specialized the eye was. And in addition to that, it's just extremely fulfilling to be able to provide someone their sight. It's just a huge part of their life. Pediatric ophthalmology is actually a field that not many ophthalmologists go into, and I think primarily because it's very challenging to examine a child. These are oftentimes very small children. They're scared, they're intimidated by the doctor. So I think as a pediatric ophthalmologist, you have to be willing to be creative, silly, playful, sing songs in order to get a good exam. So I really like that aspect of the pediatric side. Strabismus, like pediatric ophthalmologists, is also a very challenging area because we're dealing with oftentimes adults who've seen multiple specialists, oftentimes had surgery when they were younger themselves, and have dealt with a lazy eye or a wandering eye for many years. It can be very subconscious for them, and it's something that always bothers them. The ability to straighten their eye after years and years of having a lazy eye is so incredibly rewarding because they're so appreciative and so happy. And many times they just don't realize that my specialty, strabismus, is out there and an option for them. I really love the relationships that I build with my coworkers and my patients. Here at MEC, we're like a family, and I love coming to work every day. I feel like the coworkers that I work with every day are not only my colleagues, but my friends, and I love getting to know them. And in a similar way, I love getting to know my patients, learning about their siblings, what grade they're in, what their hobbies are, things like that. I think it all contributes to the doctor-patient relationship. Helping people and trying to meet their specific needs really energizes me. I think that clear vision is something that brings people true value and joy. You know, seeing your grandchildren, watching a sunset, or staring at the ocean. These are all visual experiences that contribute to the human experience. And so if somebody doesn't have that experience, it's devastating to them. And I think the ability to potentially bring that back to somebody is huge and very rewarding. So I have lots of hobbies. I had a lot more hobbies before I had kids. So my hobby now is being a mom. But I love to sew. I started sewing at a very young age. My mom taught me how to sew. I have an embroidery machine, so I embroider and monogram. I love to read. I love books, audiobooks, podcasts. I like to work out, stay healthy. I do this workout class called Orange Theory. I don't know if you've ever heard of it before, but it's really good, very intense, and I love it.